There are 7 metrics, if you will, to get it down to a quantifiable situation that each region has to look at. First are the infection rate, the number of hospitalizations, the 14-day decline in hospitalizations, or under 15 new hospitalizations. That means you're controlling the hospitalizations. New hospitalizations under 2 per 100,000, so you know that the virus, again, is under control. Then number 4, let's learn from the past. We had a true public health emergency that we were in danger of overwhelming our hospital capacity. Let's make sure we have 30% buffer in a number of available hospital beds in case that virus takes off again on you. You want to make sure we have hospital beds, so hospitals up to 70%, but 30% available hospital beds, 30% available ICU beds. Many of the people who come in with this virus need an ICU bed. We want to make sure we have the ICU beds if we need them, God forbid. And then testing capacity, so we know what the virus spread is doing. You don't know what the virus is doing unless you are testing. And then the tracing that fits with the testing program. We've been doing more tests than any state in the United States of America. So New York is way ahead in what we're doing on testing. We've come up to speed faster. We're doing more tests per capita than any country on the globe. So we're doing very well in that regard, but you need it in every region. It doesn't help the Finger Lakes if the Capital District has enough testing. You have to have enough testing and enough tracing in the Finger Lakes. So each region has to have that in place, and we understand that. We can measure this. This has always been about data and science for us. And you can look at it, each individual region, and you will know where each region is in the state by those criteria. So you know what your infection rate is, you know what your hospitalization rate is, you know how many tests you need in place, you know how many tracers you need in place. This can be a science. It can be measured, right? And that's what we want to do. We want to demystify this entire issue. It sounds like a science fiction movie. I know. I feel like we've been living a science fiction movie. But you can also study it and analyze it because we have a lot of experience now, right? We've been living with this for months. Other countries have lived with this for months. So let's learn. Let's be smart. That's who we are. And we can do that by each region in the state. And you see, depending on the region in the state, some regions are ready to go today. They just need to get some logistical pieces in order by the end of the week. Some places are very close, Central New York, just 1 or 2 criteria that haven't been met yet. And you can do that with Long Island, New York City, all across the state. When we reopen, we're talking about a phased reopening. That's what everyone basically is doing. The question is moderating that phasing and doing it intelligently, but starting with construction and manufacturing, retail, curbside pickup, agriculture, forestry, and fishing, then to phase 2, phase 3, phase 4, monitoring all along. We start with businesses that are more essential and pose a lower risk, right? Because once you say we're going to reopen, they say, well, what first? Well, really, everybody says me first. After me first, what businesses first? Those that are most essential and those that pose a lower risk because you can socially distance, etc. That's the matrix to make the decision. And then businesses have to do their part also. This is not a one-sided affair. Businesses have to put safety precautions in place. We understand what has to be done, how the workforce has to have personal protection. They have to be socially distanced. The workspace itself, in some cases, has to be adjusted, reconfigured. How do you have people work, but they're 6 feet apart? They don't come to a cafeteria. There's no gathering, right? That's what we're trying to avoid. And then what processes do we have in place to test those employees? Or if an employee is symptomatic, you can get them testing right away. You can then do tracing within the workforce. You look at what's going on around the country, just listen to the news. Those meat processing plants where you have hundreds and hundreds of workers getting sick. We have an agriculture plant in Madison County that dozens of people got sick. It's not about the meat or the agriculture, it's the gathering, it's the density. That's what creates the problem. So learning those lessons and making sure we don't make those mistakes here. On retail, all retail will be authorized to do curbside pickup or drop off or in-store pickup. The essential retail, which has been open all along, will continue operating under the current protocols. We'll also open certain businesses statewide, which are low risk, landscaping, gardening, low risk recreational activities like tennis, drive-in movie theaters. Talk about going back to the future. Back to drive-in movie theaters. I'm okay with that, by the way.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.